Okay. Oh, maybe let me just check the audio. Okay, great. Hello, and thank you for joining today's webinar. This is Tom Banky with Forward Community Investments, and we're excited to have you join us for today's presentation. This presentation is especially exciting for us because it represents the launch of our monthly webinar series on racial equity. And at this point, I'd like to also mention that we are re-recording this without a live audience due to some technical difficulties that we experienced last week that seem to be system-wide with the GoToWebinar and GoToMeeting software. So we apologize for those who set aside time for this, but hopefully we can make up for it today with this wonderful presentation. So before we get going, I'd like to take this opportunity to share some background on how we got here today. Forward Community Investments has been serving the state of Wisconsin for over 20 years. FCI transforms Wisconsin communities by supporting organizations and programs that reduce racial, social, and economic disparities. Community, partnership, inclusion, and equity, these four words represent what we value most here at FCI. In 2013, we sought feedback from nonprofits, investors, businesses, foundations, community leaders, and citizen activists around the state to better understand the critical issues communities are facing and learn about how we can work together to create a brighter future for Wisconsin. Last year, our board approved an updated vision and mission that reflect what we heard from these partners and make explicit our commitment to transforming Wisconsin by making communities fairer and more just. Our mission is to be an investor, connector, and advisor for organizations and initiatives that reduce social, racial, and economic disparities in Wisconsin communities. Our vision is an equitable and inclusive Wisconsin that is built on cooperative social action. With the help of BMO Harris Bank, we were able to offer this series of webinars to provide partners with tools and approaches that can be used to advance social, racial, and economic equity and inclusion within their work at no cost to you. BMO Harris Bank is an active partner in Wisconsin communities and demonstrates strong corporate citizenship as an important part of whom they are and how they approach community. Volunteerism and corporate responsibility are a key part of the culture at BMO Harris Bank. It's how they demonstrate their commitment to and investment in the communities they serve. Today's presentation will be Taking on Racial Equity with Angela Russell of the CUNA Mutual Group. Angela is the manager of Diversity and Inclusion at CUNA Mutual Group in Madison, where she is working to create healthy communities and ensure that everyone has the opportunity to live up to their fullest potential. She is continuously learning and working to integrate the practice of mindfulness, compassion, and kindness. She has been described by others as energetic, highly motivated, innovative, and a results-driven leader with more than 14 years of experience, professional experience. During this webinar, Angela will explore the following topics. What is equity? How do we do equity work? And how can we integrate equity into our work? At this time, I'd like to turn the presentation over to Angela.
Thanks, Tom, and thank you to Forward Community Investments for having me here today. It's an honor to be able to share a little bit about what I love doing with folks throughout Wisconsin, and I think throughout the nation, right, Tom?
Absolutely.
All right, great. So before I get started on talking about taking on racial equity, I do want to acknowledge that we do have a great deal of pain going on throughout our country, or out our world right now, with the terrorism that's going on in Paris and throughout our in Beirut and in Africa and throughout our world. And as I was reflecting on giving this presentation today, I came across this poem that just helped me realize that all of us are connected, and we often want to get into the Olympics of who and what country is hurting more, but we have to, for me, it's a great reminder to realize that we're all connected. And I just wanted to share this poem at the top of this webinar, and it's by a Somali British poet, Warren Shire, and it says, "Later that night, I held up an atlas in my lap, ran my fingers across the world, and whispered, 'Where does it hurt?' It answered, 'Everywhere, everywhere, everywhere. We know that throughout our entire globe, people are hurting, and I think each one of us has a responsibility to figure out what we can do to make changes in our own sphere of influence, and that's what we're going to be talking about today. But I did want to acknowledge about a lot of the pain that's going on in the world. All right, Tom, you ready for us to take on racial equity?
We are.
All right, let's get started. So our first slide, how I like to begin these presentations is with this quote, and this quote really grounds me in this work. So as Tom mentioned, I have 14 years of professional experience, and most of my experience has been in the public sector. And what we historically liked to do in the public sector is help those vulnerable populations and help those poor people or help those that seem a little bit inferior to us somehow. But what racial equity is all about is not setting up an us and them dynamic, but it's really about realizing how we're all in this together. And this quote by Lila Watson really helps ground me in my work, and I'm delighted to share that with you. And it says, "If you've come to help me, you are wasting your time. But if you've come because your liberation is bound up with mine, then let's work together." And this is, again, a reminder for each one of us that when we are working to create a better place for all of us, it's not just about creating separateness. It's about how can we come to the table, all of us together, and creating solutions together. All right, before I go into the details of the presentation, I want to share some ground rules. And I don't have a live audience, as Tom mentioned, but I think these ground rules will be really relevant as you listen through the presentation, and if you want to use the content of this presentation other places as well. And I will tell you that these ground rules that I use for this particular topic are taken from the YWCA here in Madison, because they do great work in racial justice, and I've adapted some of these ground rules from them. So number one, I do want to acknowledge that talking about racial equity can be emotionally triggering. So there will be emotions that may come up, and as they come up, just breathe and take note about what's coming up. And take care of yourself. If you want to pause and then come back to it a little bit later, do that. If you just want to jot down what emotions are coming up, you can do that as well. Number two is use I statements. When you're thinking about doing these kind of conversations elsewhere, it's really important to talk about your own experience. So for example, I'm a Black woman living in Dane County. I'm not going to speak for all Black women in Dane County. I will speak on behalf of my experiences and my own knowledge. Also, another really important ground rule is to be honest and willing to share. Listen to folks with curiosity and the willingness to learn and change. Suspend judgment and be open to the wisdom in each person's story. And I think this is really an acknowledgement that we are all coming at this work through our own experiences and backgrounds and stories. So, and every person has wisdom to add. Another one is respect for one another, verbal and nonverbal. And this is really important. This is a good reminder for me. I have a terrible poker face. So when I'm in these conversations, I have to really be aware of what kind of signals I'm sending out facially. Assume good intentions, but also know that we can have unintended impacts. And what this means is that, in general, assume that people are coming from a place, and assume that you're coming from a well-intentioned place, but also know that sometimes the intentions of what we say or do can have unintended impacts or unintended consequences. And I'll just pause to give a quick example of what this is. Lots of times, and my friends will probably, well, this happens to me. My friends know that this happens to me more often than I'd like. So lots of times in racially mixed groups, you have someone who's white and another person that's black, and the person that's black, I'll just say myself, has interesting hair. I have dreadlocks. So a well-intentioned white person may say, oh, I want to learn about this person's hair, and asks, can I touch your hair? But the unintended impact of asking to touch someone's hair is further othering. So, it's good for me to assume that the person was well-intentioned, and folks generally are, but it's also important for the other person to recognize unintended impacts of their actions. And also know that when it comes to racial equity, we are all on our learning journey. I am certainly, while this is my profession, I am still learning as well. So, all right, those are our ground rules, and now we can get started. Tom, are you ready?
Yes, ma'am.
All righty, here we go. So we know that the demographics of our country are changing quite a bit. So this slide represents the demographics of the U.S. by percentage of people of color in 1980. And so this is a county by county representation of percentage of people of color. So we are located in Dane County, Wisconsin, and you can see in 1980, the percentage of people of color living in Dane County wasn't that high. And here are the projections to 2040 of percentages of people of color by county throughout the nation. By 2040, Dane County is projected to be 40 to 50% people of color. And so if we don't have a good grasp on racial equity now, and we don't begin to delve into this and change how we do our work in a more diverse and inclusive way, it doesn't bode well for us in the future. If you all want to go get more data and more information on these demographic shifts, I'd encourage you to visit the Policy Link organization that is listed on this website. They are a national think tank on racial equity, and they have incredible data on people of color throughout the nation and demographic data, and they make a really incredible business case for doing racial equity and have suggestions on how to do that. So if you want more information, I'd encourage you to visit PolicyLink. But again, I do want to make the point here that our country is changing, and we need to be well informed and equipped to adapt and thrive in the changing demographics of our country. So here are the presentation goals. So I'd like folks to come away from this presentation with a shared understanding of what we mean by diversity, equity, and inclusion, and some information on and awareness on how to integrate equity into an organization's work. And if you can just take a few minutes right now, and I'll give a little bit of time here, to write down one goal that you have for yourself for this presentation or discussion. You can go ahead and jot that down right now. Alrighty, I'm going to move us forward a little bit. So what is racial equity? I want to define, this is going back to, again, to the PolicyLink organization. There's their URL. This is the definition that I'm going to use for our discussion on racial equity. Equity is a just and fair inclusion into a society in which all racial and ethnic groups can participate, prosper, and reach their full potential. The next part of the definition is a part that I think is really important, and it says that equity gives all people a just and fair shot in life despite historic patterns of exclusion. We know that throughout the U.S. we have folks, particularly people of color, that have been faced with historic patterns of exclusion, and with equity we're making sure that everyone has a fair shot despite those historic patterns, and that's really, really important. The next couple of slides, I have a couple of visual aids to help us illustrate what we mean by equity. So what this slide talks about is the difference between equality and equity. So at the top of the presentation, I mentioned that I come from a background in the public sector. And in the public sector, we wanted to treat everyone the same. And so that is the equality image that you see on the left-hand side of your screen. So when we treat everyone the same, everyone's getting the same input. But what equality, from my background and the work that I've done, it's looking at equality of inputs as opposed to equality of outcomes. So in an equity frame, we're focused on equality, but we're focused on the equality of outcomes, not the equality of inputs. And in an equity model, you'll see this image on the right-hand side, is that to give everyone a fair and just shot to live up to their fullest potential, it's making sure that folks have what they need in order to live up to that fullest potential. The other thing that I want to note in terms of the equity picture is that there are a lot of ways to get to equity. So this image shows that you have three folks as having a redistribution of resources. That's one way to get to an equity model. Another way is to include folks in the baseball game, so buying tickets for folks to be in the stadium. Another way to get to equity in this model is by removing the fence. So what are the barriers that are preventing folks from having an equal outcome? And another one that comes up when I do this presentation is that you can put the short person on top of the tall person, but what that requires is trust. But again, I do want to highlight on this the difference between equality just giving everyone the same thing, which doesn't ensure equality of outcome, versus equity, which is making sure that everyone has what they need in order to reach the desired outcome. All right. And this next slide it's another visual image of what typically has happened in an equality model. So what you have here is a professor and some animals, and the professor says, for a fair selection, everyone has to take the same exam. Please climb that tree. Well, we know that in terms of this particular model, all of these animals are different, and there's only one or two animals, I would argue, that are capable of climbing the tree, the monkey and the bird. So again, this is not focused on equity. This is focused on equality and giving everyone the same thing, as opposed to giving folks what they need to ensure equal outcomes. All right, so we've got the equality versus equity and the professor. So I hope those illustrations help in terms of what we mean by equity versus equality. Now, this framework is a framework that I used when I was in our local public health department, and it's adapted from the Bay Area Regional Health and Equities Initiative, and this particular image is from Alameda County Health Department. And what I really like what this does is that how it differentiates downstream outcomes from the upstream root causes. So when I started in public health, one of my very first projects was looking at disparities between Black and white women due to breast cancer, looking at mortality disparities due to breast cancer between Black and white women. And if we just focus on the right-hand downstream part of the slide here right now, that's looking at differences in mortality. It's very downstream. Other downstream outcomes that you see by race include diabetes, cardiovascular disease, those kinds of things. So you've got mortality. But we also know that there are also different downstream outcomes by race as well. Education, housing, income, incarceration, a whole lot of things. But what's really important is if we're going to find sustainable solutions to making sure that these disparities don't persist, is that we have to peel the onion way back and identify root causes. So if I'm using a public health model, continuing to use a public health model, I look at mortality. But what causes the differences in or disparities in mortality? It's differences in disease and injury. But if we peel that onion another layer, we'll see that there are differences in risk factors and behaviors. But let's continue to peel back the onion a little bit more. We know that social inequities such as neighborhood conditions, residential segregation, and workplace conditions can lead to disparities in risk factors, which leads to disparities in disease incidence and prevalence, which then leads to disparities in mortality. So let's just pause here for a second, and let's take a look at residential segregation. We know that our country has a history of redlining, which has racially segregated neighborhoods across the country. And we know that the history of redlining and segregation has led to differences in resources throughout our communities, throughout our nation. So there's been a lot of talk about food deserts and access to healthy foods, and those disparities in access to healthy foods have been driven by residential segregation and neighborhood conditions. And that difference, so if you've got neighborhoods that don't have access to healthy foods or good access to safe recreational facilities, we will have a difference in risk factors and behaviors. So nutrition will be different, physical activity will be different, which will lead to differences in diabetes or disease and injuries. So if you're not exercising, if you don't have good nutrition, you may have a difference in diabetes rates, for example. And then with differences in diabetes, you will have differences in death. So I'm peeling back that onion a little bit more just to show you how social inequities leads to differences in risk factors, disease and injury, and mortality. But if we peel back the onion several more layers behind social inequities, we see that a lot of our social inequities are driven by institutional power. So I mentioned redlining in terms of neighborhood segregation. That was driven by institutional power, by our government and our banking industry. And what causes our institutions, each one of us we're a part of, to do things differently and do things that aren't helpful is discriminatory beliefs. And I think that we can relabel Or in addition to using the phrase discriminatory beliefs, we can also use bias. But let's just focus on discriminatory beliefs. What kind of discriminatory beliefs are there? There's discriminatory beliefs by race, class, gender, gender identity, immigration status, national origin, sexual orientation, disability, a whole variety of things that we can have discriminatory beliefs on. And again, so those discriminatory beliefs can feed into what we do with our institutional power, which can have impacts and do have real impacts on social inequities, which then has a ripple effect throughout risk behaviors, disease and injury, and our downstream outcomes that we see. So again, our discriminatory beliefs can have a huge ripple effect across populations throughout our country and quite frankly our world. So one thing that I do want to pause about and just highlight is that a lot of our discriminatory beliefs, and this is where I'm going to transition to talking about bias a little bit, some of them are explicit and some of them are implicit and unconscious, that we don't even know that we are that we have some of these biases. And so in the next slide, I'm going to take a few minutes to just talk a little bit about bias and how bias can lead to some really bad downstream outcomes a little bit. So what is bias? What do we mean by bias? So bias is a tendency. Most biases, like preferring to eat food instead of paper clips or assuming that someone on fire should be put out, are helpful. But cognitive shortcuts can cause problems when we're not aware of them and we apply them inappropriately, leading to rash decisions or discriminatory practices. Relying on biases but keeping them in check requires a delicate balance of self-awareness. So I'm just going to go back to this this framework for health equity slide for just a second. And a lot of our discriminatory beliefs are driven by bias, and it's really important that we are aware of what these biases are and what we can do to overcome them. So that's our slide again, and then there's the definition of bias. And I'm going to take a moment just to talk about 3 layers of bias. There's individual bias, institutional bias, and structural bias. So individual bias here can be both explicit and it can be implicit or unconscious. An explicit bias would be me telling Tom, who I'm sitting by, that I don't like plaid shirts. He's wearing a plaid shirt, I don't like it. That's an explicit bias. An implicit bias is what you see, what happens in the workplace often, where you have resumes of folks coming in and you're trying to hire a position. But what happens is that if you have a black sounding name, you are less likely to get an interview if you have a white sounding name. 2 exact resumes, but just the name changes just the name is different, and you're more likely to get ahead if you have a white sounding name. The research has shown this time and time again, and for the most part that is not an explicit bias. People are not saying that, oh, this person sounds black so we're not going to interview them. It's an unconscious thing that's going on in the back of our brains. I will just talk about, and if you all want to Google this or find this on YouTube, there's a great video or interesting video that was out several months ago, and it was called Jose versus Joe. So this gentleman's name was Jose, and he was sending out resumes, and he couldn't get in a call back. Sent out lots and lots of resumes, didn't get a call back. He took out the S in his name and became Joe, and then all of a sudden he got callbacks on his resumes for interviews. Again, that's just an example of an implicit individual bias. So individual bias is prejudgment, bias, or discrimination by an individual based on race, gender, sexual orientation, etc. Institutional bias. Institutional biases are policies, practices, and procedures that work to the benefit of certain people and to the detriment of others, often unintentionally or inadvertently. So an example of this would be in Wisconsin, we've had this, of where we've had folks or legislators who want to create rules around voter ID laws. And that is more of an institutional bias that will exclude a group of people or provide a barrier for a group of people that want to vote. And that's an example of an institutional bias. And a structural bias is a history and current reality of of institutional biases across all institutions that combine to create a system that negatively impacts folks. So we know that there's bias in our educational system, there's bias in our healthcare system, there's bias in our criminal justice system, biases everywhere. And these biases are particularly detrimental for folks of color, and it leads to lots of consequences in terms of disparities in mortality, disparities in education, disparities in incarceration rates. All of those structural things all of those institutional things, lead into an overall system and structure of bias. So David Brooks writes for the New York Times, as many of you probably already know, and he had this incredible quote on bias, and I think I've used this a lot in my presentations when I talk about racial equity and bias, and I think it's a useful reminder. And what it says is that many of our anti-discrimination policies are focused on finding the bad apples who are explicitly prejudiced. In fact, the serious discrimination is implicit, subtle, and nearly universal. Both blacks and whites subtly try to get a white partner when asked to team up to do an intellectually difficult task. In computer shooting simulations, both black and white participants were more likely to think black figures were armed. In emergency rooms, whites are pervasively given stronger painkillers than blacks or Hispanics. Clearly, we should spend more effort rigging situations to reduce universal, unconscious racism. And that's a quote from David Brooks, and I think it really does a great job of highlighting what we're up against. So here's some characteristics of implicit bias, and the information from this slide is from the Kirwan Institute for the Study of Race and Ethnicity, and that's highlighted at the bottom of your slide. And a great organization that you may want to look at in terms of learning about implicit bias, stereotype threat, and racial anxiety is the Perception Institute. But here are some characteristics of implicit bias. Implicit biases are pervasive. Everyone has them, even people with avowed commitments to impartiality. Implicit bias and explicit bias are related but are very different from each other. They're not mutually exclusive and may sometimes reinforce each other. I will give an example of how they are related. Actually, I'll give this example after this next bullet. Implicit associations that we hold do not necessarily align with our declared beliefs or even reflect stances where that we would explicitly endorse. So this is something that happens a lot here in Dane County and Madison. We tend to be very progressive and liberal, and we are committed to being progressive and liberal. And so what happens is that we say that we love everybody. We want to be, we want the best for everyone. We don't have biases. We love people of color. But if that were actually true, and that we do actually love everybody in a real way, we wouldn't see the disparities that we see here in Dane County, particularly between blacks and whites. So again, while we think that we are explicitly awesome, and we probably all are explicitly awesome, each one of us has some work to do as it relates to our own implicit and unconscious biases. Another point regarding implicit bias is that we tend to hold implicit biases that favor our own in-group. Even though research has shown that we can still hold biases against our in-group. And this is particularly important as it relates to African Americans. So Harvard has done this amazing assessment of millions of folks called the implicit association test. And what the research shows from the implicit association test is that 50% of African Americans still have an implicit association favoring whites versus blacks. And that's that I would argue that is some internalized biases that need to be looked at. But again, it's just really a reflection of our systems and structures that are around us all of the time. The good news is that implicit biases are malleable. Our brains are incredibly complex, and the implicit associations that we have formed can gradually be unlearned through a variety of deep biasing techniques. And that's great news. And I think part of the work that each one of us has to do, myself included, and I am doing this work, and it has changed some of my own biases, is making sure that we are aware of the types of media that we're consuming and who our friend groups are and what we're surrounded by and listening to. All of that has a role. And I have a quick little story to share about implicit bias. And one bullet point that's not on here, but it's really important, is that implicit biases start at a very young age. So I have two children. One is 5 and the other is 7. And they are both biracial, and one is brown like me. And the other is more fair skin like her dad. She has fair skin, blonde hair, blue eyes, and my son has brown skin, brown hair, and brown eyes. And a few years ago, when he was 4, he came home and he said he wanted to take a bath right away. And I'm like, what's up, buddy? You never want to take a bath. Like, I don't understand what's going on. He wanted to take a bath because he wanted to get the brown off of his skin. And for me, that was gut-wrenching and hard to hear, but we worked through that a little bit. And then last summer, he came home again talking about race, and he said, Mommy, I just want to be white like Daddy and my sister. And I asked him why, and he said, being white is better. And again, that is an example to me that our biases are started at a very young age, and our reflection of what we're surrounded by. So as a mom, I've intentionally tried to increase the amount of diversity of books that we have in the household. I changed the library that we go to on a regular basis. Instead of going to the one that's 3 blocks from my house because it doesn't have a diverse selection or a diverse clientele, we go to the library in our city that has a much more diverse selection of books and a more diverse population. And then I'm intentionally taking my kids to different events where they will see people who are similar to them that are brown or and that's an intentional thing that I have to do as a parent. And if you live in a community where the population of folks of color is low, there is small, you will have to do some intentional work. It would be far different, I think, if I were in Atlanta or DC or where my family's from in Louisiana or Alabama. But given that I'm in Madison, Wisconsin, I have to do things slightly differently. But again, implicit biases start at a very young age, but there are things that we can do every day to help check ourselves and begin to change. So I mentioned that what we get in our media and what we see on a day-to-day basis really does prime our unconscious in really interesting ways. In this slide, these 2 pictures have been used in a lot of presentations in terms of an example of what happens when we're not careful about our media consumption. So these 2 images are both from Katrina, post-Katrina. And on the left-hand side, you see a black person in water, and on the right-hand side, you see 2 white folks in water. But the captions are very different. Same picture, but very different captions. So on the left-hand side with the black person, it says, a young man walks through chest-deep floodwater after looting a grocery store in New Orleans on August 30th, 2005. And then on the right-hand side with the 2 white folks, it says, 2 residents wade through chest-deep water after finding bread and soda from a local grocery store. So on one hand, you have the media pathologizing the person of color, whereas on the right-hand side, you have the white folks being resourceful. And unless you're in this business of seeing this day to day and being able to identify what's going on, you're not necessarily it's not necessarily going to be at the top of your mind. But what happens is that when you see this, is that it's priming our unconscious bias to say, oh, there's that black person doing that pathological, if you could see me right now, I'm doing air quotes, pathological thing that's not okay. Whereas those white folks are being, wow, they're really resourceful. But that's actually not that's not reality. They're both doing the same thing, right? So it's really important to be aware of how media is framing things. And even though this was 10 years ago, this kind of thing still continues to this day. So just being really conscious and aware of how the media is portraying things and how you're reacting to when things like this happen and what questions you're asking. So how can we begin to identify and address implicit bias? There are a lot of things that we can do. Number 1 is recognize that we all have it. No one is immune. So I think what happens a lot in racial equity work or social justice work is that we feel like as a practitioners that we've got it down. We are immune to this stuff. We are more than human and we're superhuman and we've got it. But no one's immune to implicit bias, and each and every one of us is in this together in terms of working on this. Make sure that you become aware of your implicit bias. So make the implicit explicit. Take the implicit association test from Harvard, and I'll have a link to that at the end of this presentation. Participate in implicit bias trainings and diversity seminars, evaluate current media sources and consumption. And again, what we see in the media really does shape and prime our unconscious mind. So being aware of that is really important. Getting feedback from a trusted colleague. This is also really important when you're, I think at any job, but what I do often is if I'm feeling kind of wonky on something or not sure, I go to folks and say, wait, am I seeing this the wrong way? What am I not seeing? And it's really important to have I would say more than one, a group of trusted colleagues that you can bounce things off on. Improve conditions for decision making, thinking slow. So there's this book called Thinking Slow and Thinking Fast, or Thinking Fast and Thinking Slow. And we know that when we slow down our thinking process and when we have time to process things as opposed to snap judgments or quick reactions, we make far better decisions. So make sure that you have space and time to make decisions rather than rapid judgments. And then increasing intergroup contact. That's something I mentioned that I'm doing with my kids, making sure that I am surrounding them with lots of that I have a community, quite frankly, not just my kids, that I have a very diverse community and group of friends and that I love and relate to, and that helps me and it helps my kids and it helps everyone. So making sure that we have a great intergroup contact. So those are the things that I would suggest in terms of identifying and addressing implicit bias. So at the beginning of the presentation, I said that emotions will be triggered. If you could just take a minute and talk about or think about how you are feeling right now and why. Oftentimes I do this presentation in front of an audience, and what I say is, I hope no one's feeling hungover. There's a little emoticon of feeling hungover. So if you're hungover, since this is just recorded and we don't have a live audience, you can admit that to yourself. Go take some aspirin, drink some water, whatever. But hopefully you're not. Anyway, so lots of times I hear people that are feeling guilty, feeling exhausted, frustrated, not know what to do, but also engaged. So there are a lot of different feelings that can come up. So just check in and jot down what you're feeling and why. All right, I'm going to keep us moving forward. So what does all of this mean for your work? What does racial equity mean for your work? What do we need to learn about implicit bias, and how do we integrate all of this information into what we do on a day-to-day basis? So equity within organizations, in order to do it in an effective way, you have to build organizational capacity to explicitly address racial equity. And that means making sure that we have training and staff are well equipped with the knowledge and skills that they need to know in order to do this work effectively. The Center on the Study of Social Policy has a great resource on the skills and knowledge necessary to do racial equity work. And I'd encourage you all to visit the Center for Social Policy and visit and get their list of things that they are looking at for their staff, specifically the skills and competencies that they want their staff to have to do this work. Another thing that is important to do is to create a common understanding of the root causes of racial and ethnic disparities and the possible solutions with a focus on justice and equity. The reason why I say justice, a lot of times in the government world, the nonprofit world, the philanthropic world, we focus on charity, and that's giving money, and giving money is great, but it's not enough in order to create a new world where everyone can thrive. Creating justice is making sure that we have a that everyone has that, going back to that picture, that everyone has that opportunity to live up to their fullest potential. So that I'm distinguishing what the difference is a little bit between charity and justice. And I think we should really be focused in on the justice piece. In your communities, it's important to raise the visibility of other current equity efforts as well. So we know that generally we're not the only ones in the game, and quite frankly, we shouldn't be. It's organizations working across and with each other that are going to make a long-term sustainable difference for communities. Explore and advance policy solutions, and the last one is probably the toughest one of them all. Identify, dismantle, and prevent institutional and structural racism in agencies and systems. That's far easier said than done. What do you think, Tom?
Yes, very hard to do.
Yes, but something that we should be aware of and try to do and strive for. That's right. So what are some common themes and emerging best practices in doing this work at an organization. Number one, having high level of support is essential. So my job at CUNA Mutual is I'm the manager of diversity and inclusion, and what we're trying to do is attract, retain, and develop a diverse workforce. And that for me is great. And the thing that's making a difference at CUNA Mutual is that we have a CEO that's driving this. It's not just me as a diversity and inclusion manager. In fact, he came on as CEO in January of 2007, and shortly thereafter, he added inclusion to one of our core company values. So not only did he add the inclusion to one of the core company values, diversity is a key part of our corporate strategy. So we have that very high level of support, which is essential. Long-term commitment is also very important in emerging best practices. If you think about the slide that I had in terms of how we got the downstream versus the upstream, we didn't get to where we are overnight. And so it would be a little naive for us to think that we are going to solve all of the racial equity problems within 3 to 5 years. So, because it's actually been centuries worth of oppression in our country. So we have to have a long-term commitment in this. We can do a lot in 3 to 5 years, and we should, but to think that we're going to have it all done in that amount of time is not accurate. Strategic and systematic use of tools is important. I mentioned this before, capacity building of staff and community, accountability and transparency via data and reporting. It's really important that we use data to hold ourselves accountable and making sure that we're driving towards what we said that we're going to drive towards. Collaboration and alignment with other efforts. And recognition of early wins is also important. So I mentioned that this is a long-term commitment, and it's really important to highlight when we have those early wins because that's what's going to sustain us moving forward. The other thing that I do want to say, in addition to recognizing early wins, I think it's really particularly important that we recognize when we mess up, because we will mess up. We're going to fall down, but it's really important after every time we fall down that we get up and keep going at it and learn what made us fall, and know that that is absolutely part of the process. All right. So in these next several slides, I'm going to just highlight the work of Multnomah County, Oregon. They have done an incredible job of outlining the things that organizations need to do in order to address equity. And what they've done is that they've highlighted things that you need to do at an individual level, an institutional level, and the structural level. So it follows all of those layers of biases that I talked about at the beginning of the presentation and highlights things that we can do at each level. So again, what they have focused in on is we're no longer, in terms of equity, focused in on addressing disparate outcomes. What we're focusing on for equity is addressing root causes. Now, I do want to highlight that even though this presentation is focused in on addressing root causes, I'm not trying to say that we should not focus on disparate outcomes too, because there is a place for that. There are people who are struggling today that need help today, and we should continue to do that. But if we're going to advance things moving forward into the future, we do have to begin to address root causes. Okay, so what do we need at an individual level? So again, these slides, this information is taken from Multnomah County, their Office of Diversity and Equity, which is located in Portland, Oregon. So a couple of things. Self-awareness, I would argue, is number one. If you are a leader, it is imperative that you become aware of your own biases, that you become aware of who you are, the space that you take in a room, and and what you bring to the table. I think self-awareness is a critical piece of this work, both self-awareness and willingness to be vulnerable and engage yourself in a really true and authentic way. So self-awareness, implicit bias awareness is key, which I've talked about. Knowledge of current racial inequities. Courage. It takes courage, a lot of courage, to bring up the elephant in the room. When something seems a little off, I encourage folks to say, this seems a little off, this is what I'm thinking, this is what I'm feeling, but that takes a lot of courage, but I think that it's important to do. Critical thinking, prioritization of self-care is important, and peer-to-peer mentoring is also important. At an institutional level, what do we need? A couple of things: integration of equity concepts into communications, making sure that you have people of color in leadership roles and spread throughout the organization, meaningful partnerships with communities of color. And I'm just, imagine me underlining the word meaningful like 3 or 4 times. What happens a lot is that we have inauthentic, tokenistic partnerships with communities of color, and that's not going to get the work done. That feels very othering, and just going back to the quote at the beginning of my presentation, that is not working with, that is working to or for, as opposed to working in partnership with. And meaningful, I just want to circle, highlight that, or whatever. Just realize that it's really easy to get into the tokenistic relationship, and that's not helpful. And then develop a community of practice for staff and others for opportunities to learn from each other. At CUNA Mutual, we've got a lot of folks in our community of practice. So we have a diversity and inclusion employee advisory group. We've got our employee resource groups, and all of us are learning from each other, and it's great fun, and it's really helpful. And use of community voice in decision making is also important. So what can we do at a systems level? Value and incorporate racial equity analyses into decision making. Again, making sure that we've got folks of color in leadership roles. And then this last one I want to pause on is increasing our capacity around transformational versus transactional. If we're going to really make things sustainable change moving forward, this cannot be a check the box initiative of, oh, I've got 2 people of color on my board, now I'm done. That's transactional, and what we're looking for is transformation. So think about, what does transformative action look like for you and your organization versus transactional? All right, so I did want to just let you all know, if you Google Multnomah County Office of Diversity and Equity, they have an incredible document that I'd encourage you to take a look at that really goes into depth on all of these things at a individual, institutional, and systems level. So I'm just breathing for a little bit because I know that this has been a lot of information for everyone. I feel like I've gone through it very quickly. So I just want to highlight this quick quote from Archbishop Desmond Tutu before I get into what can we do day to day. So this quote says, all of our humanity is dependent on recognizing the humanity in others. Knowing this, for me, I talk a lot about shared humanity. I talk about it so much that I thought about getting a tattoo that says hashtag. Well, it doesn't spell out hashtag, but having the hashtag shared humanity on my arm. But I think that unless we realize that we're all in this together, we're not going to be able to make that transformative change that we want to see. So what can we do day to day? Check our biases and beliefs. I'd encourage you to go out and take that implicit bias assessment. Ask questions. Have the courage to ask those questions. Commitment. Being committed to being transformed. Since I've started doing this work, I have been transformed in the most amazing ways, and it's been wonderful. Committed to continuous learning, self-care, and self-care looks different for everyone. So for some folks, for me, part of my self-care strategy is that I go dancing at least once a week. For others, it's meditation, yoga, exercise, hanging out with your group of friends, just making sure that you're taking care of yourself, because this work can be exhausting and you need things to feed your soul on a regular basis. And then realize that each one of us has our own spheres of influence. And we can actively work towards dismantling systems and structures of inequity in our home, work, and our communities. And I think that that's really important. And it's really important to know that we actually have the power to make incredible differences. So I think that there are a couple of things that I'd love for you all to take away to your organizations and begin to think about with your organizations. Number one is, what would effectively integrating mean for your organization? What would it look like now, and what would it look like in 5 years, 10 years, or 20 years? Think about, what are the costs to you and your organization and your community if you adopt a plan to tackle racism explicitly and other forms of oppression? And what are the costs for not adopting an explicit approach to addressing inequities? Those are things that are really important to think about, and I would love for each one of you to chew on each one of these questions with your company and your organizations. There is a great amount of information, a wealth of information out there on diversity, equity, and inclusion. Here is a link to the implicit association test that I've been mentioning throughout the presentation. There's an incredible little video called Cracking the Codes on Unconscious Bias. How to be an ally. I think this resource is really actually phenomenal. And when I talked about earlier how we all think that we're explicitly awesome, and we probably are all explicitly awesome, but there are things that we do day to day that kind of aren't the greatest. So this article really does highlight how can we be an effective ally. And then this next one, The Case for Reparations, honestly is one of my all-time favorite articles. It's by Ta-Nehisi Coates. He wrote it. It was published in April of 2014. And what it does is that it really breaks down the history of racism, specifically towards blacks, from the inception of our country to now. And if you want a really good, thorough understanding without having to get a master's degree in Afro-American Studies, I'd encourage you to take a look at this resource because it's great. So before I end, at the beginning of the presentation, I talked about everything that's going on around the world in terms of terrorism and violence that a lot of folks are experiencing. And I just wanted to end with this quote by Omid Safi, and he's a columnist on Krista Tippett's On Being, both on her website and on her radio show. And he had an incredible quote that I'd like to share with all of you. It says, "I would love for compassion, dignity, and the sanctity of each and every human life to be a universal human value. If it is to be, that day is in our future. I will believe that we have arrived when the atrocities in Syria, in Palestine, Israel, in Central African Republic, in Afghanistan, in Pakistan, in Myanmar, in inner city America are all treated as attacks on universal values. When these atrocities are treated as global and universal human atrocities on par with the attacks on Paris and New York, I will believe the declarations. When I see politicians marching for African lives, Afghan lives, Palestinian lives, and Black lives, I will believe their statements." That quote resonated a lot with me, and I hope it resonates with you. And I think the charge for us is that we each have to be that light for folks that are experiencing darkness, and we have to include everyone who has both formal power, like our politicians, informal power, and everyone who has a role to play to make this difference. And actually everyone does have a role to play in creating this new world that we want to see for everyone. So that is all I have for today. Thank you for having me, and good luck with your webinar series. That's it.
Please join me in thanking Angela for today's content, and BMO Harris Bank for their support. The presentation she shared was so valuable, and as with all of our webinars, the recording will be made available for playback from our website. We will be sending out a follow-up message to all attendees with links for more resources from the presentation and the aforementioned link to the recording of the presentation. Our next installment of the webinar series on racial equity will take place on Friday, December 11th with Laura P. Miniero, a PhD student in the Counseling and Psychology Department at the University of Wisconsin-Madison. She will be presenting on looking at issues of racial equity using the medium of storytelling. You can register for this webinar and find more information about it on our website. This information will also be included in your follow-up message. Just wanted to thank Angela again for a wonderful presentation, and we hope everything goes well as we keep going with our webinar equity series. Thank you so much, and take care and enjoy the remainder of your day. Okay, no, it was good. Yeah, you're good.
Oh, I was not feeling on my game at all.
Oh, really?